Hi, and welcome to another episode of KidScoop Media Online. Today we have Councilwoman Jan Perry, who was recently a candidate for LA County Board of Supervisors, race District 2. And we have three scoopers conducting this interview. We have Sarah, Renata, and Gabby. Thank you so much for joining us, Councilwoman Perry. It's an honor to have you here. Gabby, why don't you start with the first question?
Hello, and thank you for letting us interview you. How do you think LA is handling the coronavirus?
I think the City of Los Angeles, working with the County of Los Angeles, has done a good job. Now, there's a distinction. The County of Los Angeles handles all the public health funding. So you've seen Dr. Ferrer and county supervisors on television talking about, the restrictions and, the behaviors in which we needed to engage, but they worked closely with the city and the mayor of Los Angeles. And I think that it's melded very well to our advantage. But I also think that we as the public have clearly, for the most part, listened to what we've been asked to do, unlike other counties. And so our numbers are on the way down or trending down. It shows that this works.
Right, great, that's true. Renata, what would you like to ask?
Okay, my first question is, when we all start going back to school at some point, what do you recommend for us to stay safe at school?
Well, I think this virus is going to change everything, and clearly you're not going back to school this year, and hopefully you'll be able to go back in the fall. And I'm not even sure what's going to happen over the summer, but there's probably going to be some serious consideration given to continued modified social distancing and quite likely wearing masks and, spacing out in classrooms. And, that's a big operational challenge. It could even mean like splitting up the school day, so you don't have as many human beings inside the building at the same time so that you have the space to work with. Or it could mean that, classes take over the gymnasium and things like that to space people out. So I think the key is going to be people out. But, you're young and it's hard. But, I think if we speak in a manner that you are a part of this, I think that all of you can be very proactive participants in making sure that we protect everybody.
It's true. Sarah, what would you like to ask?
Sorry, I was muted. So one thing that's being talked about as part of the solution to getting life back to normal in the coronavirus is obviously ramping up our testing capacity. Yes. And another solution that is being talked about in some other states, and I'm not sure if it's been talked about here yet, is using laboratories available on university campuses in order to increase testing capacity. Is that something that Los Angeles has already started to consider?
That part I don't know, because again, remember, the County of Los Angeles administers the healthcare funds and the city does everything else. Now, there isn't anything that would prevent the city from, reaching out to, USC. They have a medical campus. UCLA has a huge medical campus, and the UCs throughout Southern California. That could certainly happen, and the city, working with the county, can be very proactive in making sure that happens. I remember when I was a little girl, very little, and Michelle, maybe you remember this, I don't know. Well, we were given on a national basis sugar cubes for the prevention of, was it polio or tuberculosis? I can't remember.
Yeah, it was before my time, but I remember the sugar cube.
And I remember standing in long lines at our elementary school, and everybody was up there with their parents, but it was part of a national strategy to, push down on the spread of that particular disease. I'm sorry, I can't remember which one it was. My mom's not alive, so I can't ask her. But, it obviously worked, because now I can't even remember what it was, but it was a huge deal at the time, huge. And the same thing may have to happen here on a national basis.
So the sugar cube worked. Is that what you're saying? In the prevention?
Yeah, and I wasn't focusing so much on the fact that it was a sugar cube. I was focusing on the fact that it was a national coordinated strategy, and that people in every community went to their local schools with their families and got the, well, I don't think it was a vaccine. It was some sort of something. Can't remember what it is. I have to look it up, or I'd have to Google it. But, you know, everybody across the country was taking it within a designated period of time.
Interesting. Huh.
Yeah, it was.
Yeah. Gabby, what would you like to ask?
What are you doing in your free time?
Well, I actually have a job, and I've had this job since January of 2019, and I always did it from home anyway. I have a home office. So, you know, when I was out campaigning during the day, and then I'd come home early evening, and then I'd do my job at night. So now I'm doing my job in the daytime, and, you know, I wasn't using Zoom so much last year. You know, I'd sending out emails and things like that, and doing conference calls. I did a lot of Uber conference, if you guys have heard of that. But so I'm working as the executive director of a group called the Infrastructure Funding Alliance. So I'm working on some development projects, and been doing that for a while.
That's awesome.
Yeah, it's fun.
Yeah. Renata?
What are some of the big takeaways from this situation? Like, what positives are you seeing from this whole experience?
I think that we can see now how important technology is to connect us, and that we have to make sure that everybody, no matter what their income level is, has access to that technology. And I'm thinking about this as I look at you guys, because you're young, and I think about the little kids who live in some parts of the city, you know, where their parents are barely hanging on and they don't have a laptop at home. And, you know, if they're not near a library or something like that, and actually they can't go out anyway, because, you know, they can't. So, you know, if you can't bring technology into the home, then, you know, those little kids get hurt, they get left behind. And that's kind of scary. So, but I think it's something that can be corrected. And this virus has helped us to identify where the holes are, where the gaps are in serving people. You know what I mean? Mm-hmm. And I think as young people, you guys are really very capable of highlighting that too, on a much higher level, because you've grown up with technology. You were born into technology.
I don't know where we would be without it right now.
We would be in so much trouble.
Yeah.
I can't even fathom it. I mean, if I don't know where my phone is every minute of the day, it's like I freak out.
Right. It's so funny.
Sarah, you're next.
So actually my question has something very closely to do with what you were just talking about. But yeah, so many experts are predicting increasingly wide achievement gaps for between rich and poor children as a result of social distancing. And I was wondering if there were any talk of solutions to this issue at the county level or in your work as well, in terms of maybe developing summer programs or something along those lines to try to address these gaps.
Well, I can tell you what I did before when I was running the Economic and Workforce Development Department, and I was working with groups like Girls Who Code through IBM, and you know, they were obviously targeting groups of people, young people who were underrepresented in the future of coding, since coding forms the basis for almost everything in technology. And so there's an opportunity here for both the public and the private sector to come together to be able to, you know, step into the breach or step into the gap there and fill it with you know, online classes, because we don't actually have to be with each other to be able to help each other. We can still do that online too. And I think the key there would be very intricate and well mapped out outreach to make sure you reach the people that you really are intending to reach. And this is what you call the post-COVID economic recovery, because, you know, not only is it an economic recovery for the parents, but it is also an economic recovery for children. As you say, they're 10 years old now, and you project that this event, this pandemic, will affect us quite likely in terms of its recovery for the next 5 to 10 years easily. So then those kids will be, you know, 10 years older, but coming from a deficit position rather than a position of strength. And so we need to recognize that now and help them and their families, because it's not only a benefit to the child, but it's a benefit to their family too, so that they'll be able to, compete in the workplace and be able to take care of themselves. I mean, I think that's what any parent would want for their child, is for that, knowing that they've been given the tools to be able to take care of themselves and lead a purposeful, safe life, so that they can thrive.
That's right. That's right. Gabby.
Have you noticed any positive changes in LA with the environment?
Yes. The sky is blue. The air smells better. It's quieter at night. I hear the birds earlier in the morning too. Have you? Yeah, I hear. Yeah. And you know what I love? I haven't actually seen this yet, but I love all the videos like on Instagram of wildlife re-emerging. And people sending videos of ducks in their pool, and I don't know, not so great on the bears and stuff, but just more animals out and about, which is nice.
That is nice. Yeah. For sure. Renata.
Who are you endorsing for the LA County Board of Supervisors, and why?
I'm not endorsing anybody at this point. But let me tell you my process that I go through when I try to figure out what, if anything, I'm going to do. I look at the person's money, where they got their money from, where they got their funding from, and that's all online for anybody to see. And I analyze that, because I want to make sure that any candidate that I think about supporting is not beholden to any kind of special interest money. And special interest money can be all kinds of things. I mean, we're living in a culture right now where you guys can Google it. It's called pay to play, where sometimes elected officials get money from particular groups, and then that group expects them to, hey, do what I tell you to do because I gave you the money. So I look at that, and then I look at how much and how deeply people are connected to the community that they want to serve. Because, I don't like to support people who are missing in action. And I look at how they express themselves. And then more than anything else, I look at what the community has to say. I listen, I ask people. I'm glad you asked the question today, because it gives me a chance to share my thinking with you. And that's the process that I go through. And then I don't like to just give a vote to give a vote. My vote's very precious to me. So a lot of depth and analysis goes into it before I make a decision. So I have not made an endorsement, and at this point I don't expect to make one. But if I do change my mind, I'll tell Michelle, and we'll all get back online again and have a good talk.
And KidScoop Media would get the exclusive. Thank you.
Well, we have the exclusive. No endorsement. Thank you.
Sarah, you're next.
So again, relating to your race for the LA County Board of Supervisors, I just wanted to express my deep respect. I really appreciated your campaign and everything you were trying to do. And I wanted to ask you, what are the unique aspects of your platform that you hope are represented by whoever wins the race?
Well, this whole issue of homelessness and mental health was an issue before the pandemic, although I've been paying attention to the statistics since 2012. So, there's been a growth of tuberculosis and respiratory illnesses, and there's some statistics on early stages of leprosy being represented in the homeless population, particularly in downtown Los Angeles. So the fact that now these people are at risk is no surprise to me, and actually find it a bit irritating that folks didn't listen to me 10, 12 years ago. I know that I went to several elected officials in high places and said, if you continue to leave these people out here unhoused without any structure, hygiene, all that, they're going to, I got a call coming in, but I'll let it go away. they're going to die, and because they're at risk. And, you know, I hate the fact that my words came true, because I didn't want them to come true.
Right. Right.
You know, I wanted people to be housed. So, you know, now people are scrambling because it's Armageddon time, or the apocalypse. So, you know, I hope somebody has the capacity to carry that issue forward and not just talk, because this is too late for talk. Talk is too late. So they better put some housing units together and do it quick.
I agree.
Mhm.
Did anybody else want to ask a question? Gabby, did you have another one? Or?
How are you handling the coronavirus at home to stay healthy?
Well, this is always with me all the time, everywhere I go. A lady in my neighborhood makes them, so I bought a bag of them, and my daughter has some. And, you know, whenever I go out walking, I wear it, and wherever I go, anywhere, like anywhere. And I get mad when I see people out and they don't have it on.
Mhm.
So I just like walk 20 feet away from them now.
Do you
No.
wear a hat and gloves as well, or do you feel the mask is sufficient for?
I try to remember. I have rubber gloves like everywhere.
Mm-hmm.
So you know why, Michelle. It's because we color our hair anyway. But I had them anyway. But I have them around, and so if I'm gonna go to the grocery store, someplace where I have to touch things that I don't know where they've been, yeah, I'll put the gloves on.
Okay.
Yeah.
Right.
Yeah.
Renata, did you have anything else?
Do you have any advice for, I'm currently a junior in high school, so do you
Mhm.
have any advice for current juniors, rising seniors, even seniors right now, dealing with this both academically and socially?
Socially, it's just really difficult, but I admire the fact that not only are you guys doing this, but also that you're talking to each other, but you're talking intergenerationally. And I think that that's a good thing for you, because it will help you. I don't know if you still have community service requirements and things like that. Do you? I don't know.
Renata, do you have community? Yeah.
So, you know, this is a unique opportunity for all of you to get people on Zoom that you might not normally be able to talk to, you know, to be able to do your projects and things like that, to, you know, even though you may not realize it, and this is horrible, you're living in an exceptional, extraordinary opportunity here, to touch people like all over the world through Zoom.
Mm-hmm.
And, you know, if you work this correctly, you know, with Michelle's guidance, because you're basically journalists, you should be able to talk to anybody you want, and that will help you enormously in your next step as you go from your junior to senior year. And for seniors who are applying to universities, my God, the essays you could write are just, they're just extraordinary. They will be extraordinary.
I mean, we're lucky to have you. I never would have thought you would sit down with us, because I mean, but this was the opportunity to do it, you know. So.
Well, you know, I would have done it anyway, virus or no virus, because I was a journalism major too.
Okay.
So, you know, in undergrad, I went to USC. So, you know, I understand the importance of, it's like gathering information by building a relationship. I get that, because that's the way I gather information. But, you know, the other day somebody said, well, we can get Dr. So-and-so from the ground zero emergency room to talk to a group of us out here in Los Angeles. And I was like, oh my God, really? That's amazing. And I want to participate in that.
Yeah, right.
You know, to hear what he has to say.
For sure.
Yeah.
Sarah, what would you like to ask?
Do you know of any plans for Los Angeles to house that part of their homeless population in hotel rooms?
I think it's called, what is it called? Operation Room Key? I think that's what it's called.
Yeah, Operation.
Yeah, I mean, I know what you know in terms of what I read in the media and the paper, and it's controversial in some areas and other areas. But I can tell you, as somebody who formerly represented the area of downtown and, you know, a bit south LA, and also, you know, around Staples, there's a lot of motels in that area that I'm sure are available. If somebody knows their community, they should be able to, you know, make arrangements, you know, because there's a lot of stock in that area, a lot of empty rooms, a lot of hotel rooms, or motel rooms rather, motel rooms.
Mm-hmm. Right.
And this is a fast way to get people off the street, very quick.
Yeah. It's shocking that more people aren't doing it. More businesses, more hotels, don't you think?
Yeah, but you know, they may want, I don't know what the deal is. I mean, I don't know what operationally, I don't know what the holdup is. I don't know if it's like a subsidy issue or a logistics issue or an insurance issue, because with everybody who takes in a number of people to fill the rooms, you do have to have a social service provider on site
Mm-hmm.
to manage their clients, you know,
Right.
so that people aren't, you know, walking around, you know, with no help.
Right.
Yeah, they need help.
Are there any other questions, or do you want to ask our reporters anything, or? I mean,
Yeah. I just, well, how's everybody doing?
Yeah, I mean, we're just hanging in there. I think for me, I'm graduating high school. I'm going to college this coming semester. So
Yeah.
I'm really just hoping that I'm actually able to move into college for my first semester. That's
Yeah. Where are you going to go?
I'm going to UC Berkeley.
Okay. Yeah. I hope so for you. I hope so.
Thank you.
I
Yeah.
hope it works.
Mhm.
And, you know, whatever happens, you know, I'm going to be talking to Michelle, so stay in touch so we can talk again.
Okay, absolutely.
That'd be great. What about the rest of you?
Renata?
Kind of the same thing here, just hoping to go back to school as soon as possible. Also, like staying safe, like not going back too soon, but
Yeah.
hoping that, because it'll be senior year for me next year, so just looking
Yeah.
forward to like just graduation in general.
Yeah. Yeah.
Gabby?
I get it.
Well, I'm changing schools next year, so I'm just hoping I get to go.
Yes. That's not too much to ask for.
You're going into 6th grade, right?
Yeah.
Yeah.
Well,
That's great.
yeah. I hope it all works the way it's supposed to for all of you. And, you know, I hope you'll continue to be information gatherers and reporters and journalists. You do a great service, you know, to share your perspectives and interpret other people's perspectives through your eyes and through your words. So I appreciate you very much. And you too, Michelle.
Oh, thank you so much. You're awesome.
Thank
Before
you.
we wrap up, I had one more question I wanted to ask.
Okay.
If that's okay. Yeah, so a lot of the issues, at least from what I've seen, that usually when we do try to build homeless shelters in a neighborhood, there's a lot of backlash, there's a lot of not in my backyard attitudes.
Mhm.
I was wondering if you had any ideas about ways that we could be combating that.
Yeah, well, you know, a lot of that comes from, you know, it's the way you design a project and that the way you operate a project. And, you know, you can either convince people that you're going to have a good operator in there who will keep the clients on site. I did a project next door to a condominium project on Skid Row, and I did a lot of outreach to the people in the condos to say, first of all, we're in the middle of Skid Row, even though you're in $1 million condo. This is going to help. This is not going to hurt. The lot is going to be fenced, and we're going to do nice landscaping. It's going to be a great design. There's going to be retail on the ground floor with a coffee shop. And, you know, the clients have a very good operator. And even now, I never hear any complaints about that project and its proximity to the condominium project. So I do think it's possible to design something that fits in with a community. I mean, if you really want to get down to the hardcore design aspects of it, you know, you put something on a corner, you don't put it between two single family houses, you know, put it on a corner so, you know, at least two sides of it aren't interacting with somebody, you know, and to make it look good. And the most important thing is you get a responsible operator who's really into their clients and is really, really paying attention, you know? So it's those kinds of elements. And then you do a lot of outreach, and you have to sit down with people. You got to let them yell at you and, you know, be angry and, you know, but you have to move them towards resolution if that's possible. But you have to go into it understanding that people are going to be angry or they're going to be scared. I understand that.
Yeah.
That lady yesterday spoke to me at the gas station and she didn't have a mask on. And she was mentally ill and she was covered with raw sores and she was trying to come up to me within 6 feet. And I told her, you need to stop right now. You're not wearing a mask. And I'm sure she was homeless, but she wasn't wearing a mask. And what can I tell you?
So scary.
You know,
Yeah.
it's okay. But I understand people's fear too. You got to deal with that up front.
Right. Did anybody else have another final question? Going
This
once?
is just something that I thought of as we were answering the last one, is also, so are there any programs that are handing out masks to the homeless populations, or?
I talked to one of the senior lead officers on Skid Row, and his name is Dion Joseph, and you guys might want to talk to him next if you feel like it, because he's the one who's walking the federal court judge around, and they're trying to create a settlement for another lawsuit. If anybody's doing it, he would know, but that's a really good idea. I know they have hygiene stations out now for people to wash their hands, and they were supposed to have more mobile facilities for using the toilet and for showering. I'm not sure how much of that is out there now, but those are certainly things that should be done, because it's a public health issue. It's not about, you know, leaving people on the street. It's probably going to save their lives.
Mm-hmm. Yeah, for sure.
Yeah.
Anything else? Any follow-up? Anything? Any favorite? What book are you reading right now? Anything fun?
I'm working all day, so, you know, I didn't have one of my friends gave me a book about a dog who's a police dog. So I'm reading that because it's really silly and funny, and I read a few pages every night so that I can go to sleep laughing. But other than that, no, I'll tell you what, I'm watching too much television.
I can ask you, are you binge watching any Netflix or Hulu or anything?
Okay, I have to admit it. I'm watching 90 Day Fiance. And that's terrible. I'm sorry, but I really like it. It's good. It's good stuff. And, you know, but that's about it. I watched 90 Day Fiance and the news, and that's about it.
Wow. Well, thank you so much for joining us today, and
Yeah,
a great experience for me, and I
wonderful.
yeah, and I'm sure for you guys as well. You guys did great. I'm so proud of my scoopers. Renata, welcome.
Yeah,
to KidScoop.
they're great.
This was Renata's first time scooping.
Very good.
So she did great.
Thank you.
And we'll stay in touch, Councilwoman.
Please do.
Thank you.
Please do. Thanks, guys.
Okay.
Thank
See you
you.
all.
Thank you.
Bye.
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 Bye. Thank you.
Thank you.